Good morning, and this week I'm presenting the case musculoskeletal system, and it's a 59 years old Asian non-Hispanic male, married and arrived at the clinic with his granddaughter, and he seems to be reliable historian. And chief complaint: I have been having pain in my right knee for the past week. History of present illness: KS, a 59 years old male Asian non-Hispanic, arrived at the clinic complaining of right knee pain. The pain claimed that a week prior he was gardening when he fell onto his right knee while rising from the ground. The patient reported that the pain was progressively worsening. He claimed the pain worsened when he moves around and drives. According to the patient, he can only endure the pain for 30 minutes before needing a break. After suffering from miserable distress from about a week, which he rates as a 7 out of 10, he started to concern. The patient claimed that taking Tylenol and laying down were the two things that helped with the discomfort, which was momentarily relieved for a few hours. Before this injury, he denied any locking, popping, clicking, injury, or trauma to his right knee. And past medical history: hyperlipidemia is controlled by diet and exercise. And hospitalization: and previously cholecystectomy in 2010, no recent hospitalization. Past medical history: cholecystectomy in 2010. Allergy: denies having a drug, food, and seasonal and environmental allergies. And medication: multivitamins, 1 tapio as a supplement, and Tylenol 500 milligram PO tablet every 6 hours PRN for pain. Preventive care: annual eye examination was performed in February 2022, dental examination in January 2023, physical examination in April 2023, colonoscopy was performed in 2019, normal. Immunization: the patient received all CDC recommendation vaccination. And family history: and the maternal grandmother died at the age of 80 with diabetes and hypertension. Maternal grandfather died at Parkinson's disease, age of 83. And paternal grandfather died the age of 70 of heart failure. And paternal grandmother died at the age of 80, diabetes and hyperlipidemia. And father hypertension alive, mother arthritis alive, brother hyperlipidemia alive, and son and daughter there is a no medical issue. Social history: living status: he mentioned that he and his wife reside in a single story home, and he has a dog. And the patients prefer Chinese over English since they do not comprehend medical terminology. And even though he speaks Chinese at home and English as a second language. And diet and caffeine: he consumes a portion of green vegetables and a low fat diet. He goes to the lunch with his wife twice weekly, consume 1 cup of coffee daily. Exercise: he takes his dogs for at least 45 minutes of daily neighborhood walks, but has had to walk less this past week because of an injury. And chemical: and he denies any drink alcohol and smoking cigarette. Occupational: he currently works for Golden One Union Bank. And social support: and the patient claims that he and his wife attend church each Sunday. Safety: he stated that he always buckle up when he drives. And review of system: the all review of system is normal except the musculoskeletal. And right knee complaint have been reported, especially when walking and using the leg to press a car pedal. Denies having back problems or even having had joint replacement surgery. And neurological: and denies fatigue, tingling, numbness, dizziness, fainting, memory loss. The patient says he walked without using a cane thin crutches walker and says he is not unbalanced while doing so. And patient objective physical examination, vital sign temperature 97.8, pulse 80, and the respiratory rate is 18, and blood pressure 120/78, oxygen saturation 98% room air, height 5'10", weight 200 pounds, and overweight, general. And KS is happy and well groomed, and he knows the date, place, person, and the circumstance, and he appears to be worried about the situation and speaks clearly. And scan, when the right knee was examined, no sign of redness as a worm and discoloration, bruising, or broken skin were found. The right knee little swelling. And the other review system is normal except musculoskeletal. A small amount of swelling was detected upon inspection, and but no bruising and laceration, obvious deformities and discoloration not found. Behind the knee, near the lateral popliteal fossa and the bilateral popliteal pulse was palpable and was found to be normal. Between the first and second toes above the foot arc, there was a normal dolorous PDS pulse on the both sides, and the lateral and medial side of the right knee, and which are the location of the injury, are palpable, painful, and when the leg is extended and abduct, the right knee hurts. The valgus test was performed while the patient was laying on his back with the entire lower extremity supported and knee flexed to 20-30 degrees. Placed on hand the medial surface of the ankle and another hand on the lateral surface of the knee, and applied valgus force to the knee with the distal hand, and which was positive. The varus test and Lachman test result were negative. The anterior draw test negative. Deep tender flex in bilateral lower extremity normal, and no limited range of motion was noted upon examination. And the skin, there is a no sores, rashes, lesions, and no skin dryness. And neurology, deep tender flex in both lower extremity normal, and the cranial nerves and two cranial nerves 12 normal, and the differential diagnose, and a sprain of a medial collateral ligament of the right knee, second right knee meniscus tear, and the third diagnosis fracture of the right patella. And sprain of the medial collateral ligament of the right knee. Medial collateral ligament injury are classified as a graded 1, 2, and 3, like all other ligament injury based on the size of the sustained tear. In the phase 1, less than 10% of collagen fibers are torn, causing significant discomfort but no instability. When we applied pressure on outside of a slightly bent knee, most patients feel discomfort, but no additional symptoms are present. A positive valgus test for the patient indicate a grade 2 sprain, and this is appropriate given that the patient has pain when walking and pressing the brake pedal, and his slightly swelling symptoms likewise indicate his right knee issues. And right knee meniscus, and one of the common type of knee injury is the meniscus tear. Any exercise that can cause you to twist and rotate your knee aggressively, especially if you place your entire body weight on it. And fracture of the right patella, and small bone is front of the knee joint is called the patella. According to the AAOS, a broken patella is a bone in front of the kneecap, only capable of diagnosing with the diagnostic tool like a X-ray. And final diagnose possible sprain of the medial collateral ligament of the right knee and rule out fracture of the right patella. Planned right knee lateral and PA X-ray to rule out fracture. Treatment elastic knee brace sport stabilizer from Walmart and patient to use at home. If more detailed instructions are required, can stop by the clinic. And education, and wear a knee brace to reduce swelling, protect your joint. This is a significant, especially in the initial phase. To promote a range of motion, exercise with 3 to 5 repetition of ease exercise to restore natural flexibility and strength and prevent stiffness. Remove the brace twice a day. Use the rice method: rest, ice compression and elevation. For the next week, apply an ice pack and cold treatment wrap for 10 to 15 minutes per hour. And knee elevation over the heart to reduce swelling. And give employees a 1 week work clearance to rest his right knee to stop future damage. Emphasize the seriousness of the injury and need to treat the extremity with care. And tell the patients to avoid driving until the right knee pain is subside when performing activity like using the leg to brake. And follow up within a week, assess the degree of pain and success of a medical intervention and X-ray result. Referral, no referral at this time. And there is a holistic approach and caring science. And collaborate with the patient, family and other care team member is essential to provide the best care for the sprained medial collateral ligament of the right knee. To major variable or cultural consideration and Gene Watson caring process, understanding and addressing these cultural concepts are essential if you want to give the patient and family the best care possible. And as a result, I would have been ready to answer queries and collaborate with the patient, family and other care team members to resolve any problems in order to improve patient's outcome. And the properly educating about treating the patient's injury, patients provide proper can against in a transpersonal teaching and Watson caring science and theory. And Gene Watson providing will be assessed to transpersonal education. And these characters procedure create a rapport important for appropriately educating the patient and establishing trust that cause them to change their perspective to recognize the degree of patient learning, potentially adjust the education to other level of comprehension. And it is important to explain to the patient in this case how to rest his injury and avoid bed rest to avoid and bed rest to avoid muscular stiffness. And that's it, and thank you so much.